heart. And this is the aortic arch right here. And the first branch off the aortic arch is going to be the brachiocephalic artery. And then it bifurcates into the right subclavian and the right common carotid. Then we have the left subclavian and the left common carotid. Then we go down here, and this is the descending aorta, with this portion up in the thorax called the thoracic aorta, and this part in the abdomen called the abdominal aorta. The division is the diaphragm. Okay. First branch off, once we get past the diaphragm and the abdominal aorta, the first branch is going to be the celiac trunk.
Okay.
And it then forms the gastric to the stomach, hepatic to the liver, and splenic to the spleen. Second branch off is going to be the superior mesenteric, or in them an anterior mesenteric because they're quadrupeds.
Okay, that's why we couldn't find it.
Yeah, it's the same thing. And it's going to the small intestine. Then we have the renal as the third branch, and there are two of them, one for each kidney. And then we go on down, and then we have the gonadals that are going out to the side, because this is a female because of her ovaries and uterus. They'll come out and go down in the male to the testes. Then this tiny, tiny little one right there, that would be the inferior mesenteric or posterior mesenteric going to the large intestine. Then you get the bifurcation, divides into two. These are the iliacs.
Okay, those are the iliacs. Okay.
And then they go on down into the leg and become femoral.
Okay, so the iliacs turn into the femoral.
Right. Okay. And this one that's right down the center, that's the caudal going to the tail, because they have a tail.
Okay.
Now, you have the femoral vein right by the femoral artery. You have the iliac veins right by the iliac artery. You have the inferior, or in the case of the rat, posterior vena cava. You have the gonadals. You have the renals. And we can't see the hepatic portal system because it's not stained. If we got them triply injected, then it would show up nice and yellow, but we didn't get them triply injected. But if we move the heart, you can see that inferior or posterior vein coming up to the heart. Now, they differ from us here with the anterior vena cava or superior vena cava. We have one. They have two. So that's what those are. And then coming off of it would be your subclavian, and then going up or coming down from the head would be the jugular. And the best way to see the jugular is here, because their external is big.
Wait a minute, thanks.
Yeah,
They have big externals, whereas we have small externals, large internals. They have large externals, small internals. That's basically it.